हाँ 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 हाँ.
Okay. My paper topic is about prevalence and spectrum of opportunistic fungal infections among post-COVID patients. I am Dr. Pralita Maudri, final year postgraduate, Department of Microbiology, SVMC Tirupati. Introduction. Opportunistic fungal infections following respiratory viral infections has been recognized since 1918 influenza pandemic. Major risk factors for opportunistic fungal infections include neutropenia, hematological malignancies, transplantation, prolonged treatment with corticosteroids, diabetes, prolonged stay in ICU, major surgery. Normally, post-COVID-19 associated fungal infections, including candidiasis, mucormycosis, aspergillosis, are on the rise during the second spike of corona as they exhibited immunosuppression with cells and pro-inflammatory markers such as interleukin 1, interleukin 6, TNF alpha, which predisposes to bacterial and fungal infections. Corona in diabetic patients leads to immune dysregulation, and its steroid usage leads to immune suppression and high risk for opportunistic fungal infections. The study was undertaken with an aim to study the spectrum and prevalence of various opportunistic fungal infections in post-COVID patients with an emphasis on immune status of the patient before COVID is analyzed. Coming to my materials and methods, this is a prospective study conducted for a period of 3 months from May to July 2021 in SVMC Tirupati. Various clinical samples with suspicion of fungal infections like sputum, corneal scrapings, nasal cavity specimens, CSF were sent to the laboratory based on clinical symptoms and organ system involved. Samples were subjected to KOH mount gram staining India in preparation. Further, fungal culture was done on Fabrod's textus agar. Species is identified by growth on SDA, polymorphology on lactophenol cotton blue, and biochemical reactions. Coming to my results, the present study included 260 samples, among which 179, that is 68.8% are male, and most affected age group are 30 to 60 years, which correlates with 64.6%. Among various departments where the specimens collected, 152 are from the Department of ENT, followed by Department of Pulmonary Medicine with 55 samples, which correlates with 21.1%. Most of the specimens were collected from patients with COVID positive with suspected fungal infection, that is about 82.6%. The common specimens received are nasal cavity specimen, which is about 65.3%, followed by sputum, which is about 25.3%. Among total samples, 260 received from patients with COVID positive are 215. In them, 154 samples, which is about 71.6%, are with comorbidities. This is the table which depicts department-wise distribution of the specimens, in which ENT department has sent the more number of samples with 152. Then comes pulmonary medicine. This is table 2, which depicts type of specimen received. Nasal cavity specimens are the highest which we received in the study. Then comes table 3, which depicts among the 260 samples included in the study, 179 are males and 81 are females, of which 179 males, 68.8%, COVID positive 152, which accounts for 84.9%, and COVID status unknown male patients are 27, which accounts for 15%. Then comes female patients, which are 81, in which 63, that is 77.7%, are COVID positive, and 18 patients, 22%, are COVID status unknown. This is the age-wise distribution of the samples. In here, 30 to 60 years age group, number of patients are 168, about 64.6%. Then comes 60 to 80 years age group patient. Then comes 10 to 30 years age group patients. This is the table which is about the immune status of the patients before the COVID. Here, among the 179 male patients, 152 are COVID positive. Among them, 135 are having comorbidities. In male patient, 27 COVID status is unknown. Among them, 4 are having comorbidities. In the case of female patients, 81, 63 are COVID positive with comorbidities. 19 patients are present. In among 18 patients, in which 81 female patients, comorbidities are present for only 2 patients. So then, in the present study, out of about 260 samples, 160 samples, that is 61.5% samples are positive. Then this is the table which tells about the samples positive for fungal elements in COVID positive and unknown subjects with comorbidities. Here, overall positive for fungal elements in the case of male are 135, in the case of female are 19, total 154 patients are positive for fungal elements. In here, comorbidities are present for 127 patients among 152 and 9 patients in females among 63. Total antibodies present are 136. In the case of COVID, status unknown. Overall positive for fungal elements in the case of male patients are 4. In the case of female are 2. That is, overall positive for fungal elements are 6. In the case of COVID status unknown patients, in the case of COVID status positive, there are 136. Then this is about the KOH and fungal culture. Total samples processed are 260. Total samples negative for both fungal culture and KOH are 30. Both fungal culture and KOH positive are 47. KOH positive are 104 among 153 samples on which KOH performed. Fungal culture positive are 56 among 107 fungal culture performed. This is the table which depicts the culture isolates which I have been isolated. Coming to the candida species is highest I have isolated in the present study, that is 73, which corresponds to 41.7%. Then comes Rhizopus, which is 42, which corresponds to 24%. Then comes Mucor, 39 with 22.2%. Then comes Aspergillus species, which is about 12, that correlates with 6.85%. Then comes Syncephalastrum, 5 isolates with 2.8%. Then comes Cunninghamella, 4 with 2.28%. This is the picture which depicts the culture isolates I have isolated. Then these are the isolates I have isolated in my present study. I have enclosed the pictures. This is the picture about Candida, which shows the creamy white colonies on SDA and budding yeast-like cells on KOH and gram-positive oval budding yeast-like cells on the gram staining. This is the Rhizopus, which shows salt and pepper appearance on the SDA, broad branch receptate hyphae on the KOH, and sporangium and rhizoid on the LPCB. This is the picture which shows Mucor, which is having the cotton candy-like appearance on the SDA with the broad branch receptive hyphae on the KOH, and sporangiophore with the LPCB. This is also showing Aspergillus with velvety, smoky green to yellow color on the SDA with broad branch septate hyphae on the KOH, and having a conidiophore with conidia vesicle phylloids covering the total vesicle on the LPCB. This is the diagram. This is the picture of a patient with Syncephalastrum in the present study, having dark gray to gray color colonies and broad branch receptate hyphae on the KOH, and this is the picture of the LPCB. Then comes Cunninghamella having broad branch receptate hyphae on the LPCB, and this is the picture of the Cunninghamella on the LPCB we have isolated in the present study. Coming to the discussion part, COVID-19, particularly second spike, is associated with opportunistic fungal infections around the world, particularly more in India. The present study includes 260 specimens from various departments. Among them, 61.5% were positive for fungal elements. Among these 160 samples, males are more affected, that is 135 for 160, which corresponds to 75.4%. This correlates with the study by Singh et al., where 78.9% of the males are affected. The most common organ affected was nasal cavity and the sinuses, which is 75% in the present study, similar to Singh et al. The most common persons affected are with comorbidities. Here, among 160 positive samples, 139, that is 85% are with comorbidities, which correlates with Mishra et al. Study, in which 87.5% are positive. The most common organism isolated in this study is Candida, which accounts for 41.7%, followed by Rhizopus 24%, which correlates with Chen et al., Tehran et al. Study. In my study, among 260 samples collected, direct microscopy positive are 67%, culture positive are 51%, correlates with the Patel L study, where direct microscopy is 87.3% and culture is 62.4%. Limitations of the study is antifungal susceptibility testing and molecular methods like PCR, automated methods like MALDI-TOF are not performed to confirm the diagnosis. Coming to my conclusion part, post-COVID patients may exhibit immunosuppression due to disease itself, further with usage of steroids and with pre-existing comorbidities. Early identification, aggressive management with antifungals and surgical debridement will reduce the morbidity and mortality with opportunistic fungal infections. Emphasis should be made to rule out the super and co-infections due to bacteria, fungi, parasites, viruses among post-COVID patients, particularly with comorbidities, to prevent the pathogenic invasion and adverse outcomes. These are all my references. Thank you. Thank you. Hello. Hello.